Okay, I think we're all waiting for the most important topic of this year, sex. I'm just kidding. We can wait till that later. Anyways, hi everyone. My name's Devina OW, and I would like to take you through my ISM journey. I think I first start off by telling you a little bit about my family and about me. On the left is me and my grandmother, and on the right are my parents. My grandmother, she's pretty much like my inspiration. I always go to her for everything. And my parents are probably the most hardworking people I've ever met. I remember, I've told you guys this story before, they're immigrants here. And my dad, he works for Frontline, he's a manager for Fidelity. And he was telling me they had some outsourcing from India. And those people from India, they came over here and they're just in a hotel room, just working. And he's like, let me take these people out. So like he understands that isolation you get when you're in a different country. And I have a lot of respect for people who can empathize with someone else. So yeah, there's my grandmother and my parents. I didn't choose the best photos for my brothers, but I didn't have any good photos. They're not as like straight-faced like that. But on the left is my youngest brother, in the middle is my second oldest, and then on the far right is my oldest brother. My youngest brother, he's going into health insurance, somewhat like what Michelle is doing. My second oldest brother, right now he's at Johns Hopkins doing a master's program, and he's majoring in biotechnology. And then my oldest brother, he's a healthcare consultant right now. He's like traveling and such and getting training. But they've also influenced me greatly. I think, we're all kind of already centered on the medical field, just like not indirectly. So yeah, I don't know what I'd do without them, really. And then, those who say cannot be done should not interrupt the people doing it. I think this quote, at first I had chosen it as just a regular quote, I just needed something real quick. And now when I was creating this last night, I was rethinking this. I started just eating my words right here because honestly, my ISM journey can't have been the easiest to go through. And I would tell myself I can't do this anymore. And here I am interrupting myself when I should be doing it. So this quote really hit me back hard, and I realized I just ate my own words. I didn't even think I did. Anyways, of course my research is into obstetrics and gynecology. What better way to help life than be the one who deliver it? Now, I didn't really have any intentions of joining ISM. I actually applied for it sophomore year, and I didn't get accepted because I didn't exactly have transportation. And I understand, a student who does have transportation has a better chance of getting in, but that's okay. And then after I didn't get accepted, I was like, you know what? I'm already going to like the health science field and track. I might as well just stick with it. And I was really not intending to apply for this class at all. And Coach Gosh, I remember anytime I'd see you in the hallways, they're like, hey, are you applying for ISM? I'm like, yeah, okay. And then I remember I was sitting in my anatomy class, minding my own business. You sent Shayna Patel after me. Hey, Devina, you should join ISM. I'm like, okay. So honestly, I had no intentions of doing ISM again. And, I think persistence is key when you do want someone to do ISM. And, I'm really glad I took it, even if all like whatever drawbacks that it may have, as of right now maybe, but it has a lot of, I think I've matured more than in a year than I have over 17 years. So I know it was worthwhile in a long time. And then again, back to my research. I honestly think the reproductive system is probably one of the unique systems of them all. The fact that women can create an entire living human being in them. And I don't know really what men can do, honestly, other than, I don't know. I just find it fascinating that we can support entirely new life and have it feed off of us. And compared to like if you put a man in labor and a woman in labor, the chances of a man even getting through the first stage of pregnancy seems hard itself. So no offense, Nate and Daniel. My research in medicine, I kind of circulated more around like obstetrics in general, like in terms of deliveries, midwives versus OB-GYNs. Midwives do more natural births, and they don't go to med school. They actually just have like an institution solely on midwives. And then they're sort of like brought more up into society. OB-GYNs, I've heard when I've done some research in my articles, they do unnecessary practices, and midwives just do the traditional birth and such. And then I also went more on vaginal cesarean sections. Vaginal delivery is more advised by doctors, though patient can opt more for a C-section if they don't want to have like the pains during labor. And I understand that, but I feel like, in a personal opinion, you know, if you go through 9 months already through all this, I mean, I understand maybe 24 to 48 hours, those pains are going to be terrible, but it's going to be worth those 9 months, you know? And another thing I also realized was doing postpartum depression screenings. I've realized that mental health in healthcare in general is not really well. Most of maybe our criminals in jails and our homeless people may have mental issues, and we need to invest more in mental health care than we ever need to before, especially with people being especially transgender, and they're not understanding when their body is changing, but they think a different way. And then another thing I researched was also elective deliveries, inducing labor at 37 weeks. There are some cases in which it would endanger the mother's life and such. And I'm like, oh yes, do it just in case. But then there are other times when a mother wants to do it. I want my baby born on this month, this day, this hour, for like some unknown reason. And it's just, well, if it's not health related or necessary, then I don't think we don't need to do that. And then one of my last things I researched was medical records. Medical records, they aren't really transferred to other doctors that well, so because the internet, it doesn't matter if you have a Yahoo or Gmail, it still gets sent regardless. Medical records, they don't do that. You have to have like fax it or mail it somehow. So I think if we were to create like a global medical record instead of internet, it would be much easier for patients and doctors to access the information. The only flaw in that is that I think it would be very vulnerable for anyone to get to it. So I think it needs to be only accessible to doctors. My first interview was with Dr. Jason Haar in North Lake OB-GYN. Again, I think we all remember him quite too well. I had scheduled the appointment for him, and he called in. He had emergency delivery, rescheduled, and then he had another emergency delivery, and then I went back that afternoon, had the interview. And in some ways, even though he was not my mentor, in a way, he did teach me a lesson about time commitment. And, you know, like, I made me like going to my son's 3-year-old birthday party, and out of nowhere, I have to go and deliver a baby who was not even mine. So it's something that's going to take me away from my personal and social life that I think I'm willing to do. My second interview, Dr. Jen Dennings at Dallas Presbyterian. I enjoyed